let's talk a little bit about the certain diseases of respiratory system. Obviously, since upper respiratory tract is exposed to the outside world, it is very susceptible to infections. Some of them I listed here, for instance, sinusitis. You have sinuses, and inflammation of the sinuses is called sinusitis. Usually a viral infection may go away by itself in a couple of weeks. In some cases, sinusitis becomes chronic, and it's usually chronic sinusitis is associated with the allergies or asthma, and it can be caused by chronic bacterial infections. Sometimes requires surgical treatment. Now, pharyngitis is the inflammation of the pharynx, can be caused by Streptococcus pyogenes, that's our strep throat. Must be treated with antibiotics, otherwise it can develop into scarlet fever or rheumatic fever, much more serious complications. Another quite rare currently diphtheria is caused by a bacterium, Corynebacterium diphtheria. Diphtheria is a severe disease during which the pseudomembrane is formed in the upper respiratory tract. It's dead red blood cells, white blood cells, dead bacteria, dead epithelial cells, and that pseudomembrane may actually block respiratory passages and may lead to suffocation and death. However, this is a vaccine preventable condition. Now, lower respiratory tract diseases, there are plenty of them. I'm going to start with a bacterial infection known as tuberculosis on the right. You can see lungs of people with tuberculosis. Inflammatory infiltrates in the lungs are quite clear on the chest x-ray, characterized by night sweats, fever, low-grade fever, weight loss, bloody or greenish sputum, dry cough. It's treatable with antibiotics. However, there are plenty of extensively antibiotic-resistant strains, which makes treatment tuberculosis much harder. Now, lung cancer is another condition associated with a lung dysfunction. It's a leading cause of cancer death in North America. 90% of cases of lung cancer are the result of smoking, not pollution, smoking. There are 3 different types of lung cancer. Small cell carcinoma being the most dangerous because it can metastasize. The key thing to send lung cancer into remission is to early detect it and to treat it properly. In some countries, for instance in Russia, people have to go through the chest x-ray every year, and that allows to rapid identification of lung cancer cases. If there are no metastasis, then you can surgically remove the cancerous tissue. If metastasis ensue, then radiation and chemotherapy will be used. Now we have some new therapies, so-called checkpoint inhibitors. People who discovered it were awarded Nobel Prize in Physiology and Medicine a couple of years ago. So they basically reactivate cells of your immune system to kill cancer cells, and they significantly increase the survival time for patients with the lung cancer. Now, this is very interesting here. This is the graph showing the lung cancer incidence by sex. You can see that in males it declines. Obviously, males smoke less, while in females it was climbing from 70s all the way up to 90s, and that, I guess, can be explained by the fact that it became more and more socially acceptable for women to smoke. Obstructive lung diseases. Obstructive lung disease is a disease in which flow of respiratory gases to the lungs is obstructed. Constrictive pulmonary disease in which airways are narrowed, like anaphylaxis, or constricted. And there's a restrictive disease in which the lung tissue itself is damaged and lungs cannot inflate. So bronchitis, emphysema, asthma are obstructive diseases. Again, risk factor is smoking. They usually have dyspnea, so it's hard to breathe, labored breathing, coughing. Pulmonary infections are frequent due to the poor ventilation. Respiratory acidosis, which leads to hypoxemia in the tissue, so low oxygen delivery to tissues. Respiratory acidosis may negatively affect kidney function. So what exactly those diseases are? In emphysema, alveoli become enlarged. They basically destroyed. So that leads to decreased elasticity of the lungs, and that leads to exhaustion because you have to use accessory muscles to breathe. Diaphragm is flattened. Emphysema is often a result of constant inhalation of pollutants or cigarette smoke. Chronic bronchitis, again, pollution, smoking. In chronic bronchitis, bronchi are permanently inflamed, mucus is accumulated, which leads to the obstruction of airways. Asthma, a reversible obstructive pulmonary disease. Everybody who has asthma knows what I'm talking about. Constriction of the respiratory passages, tightness in the chest, wheezing, usually of an allergic nature, but sometimes can be caused by, for instance, exercise. Now, cystic fibrosis is most common lethal genetic disease in the United States. It's caused by abnormal gene for one of the membrane channels that regulate the passage of chloride across the membrane in the cells. And that leads to the accumulation of very viscous mucus in various passages, including reproductive system, but not only reproductive system. It can affect pancreatic ducts or reproductive ducts. So respiratory system is heavily affected. It's not curable. There are treatments, mucolytics, drugs that dissolve mucus, percussion of the chest to loosen mucus, saline, inhalation of the hypertonic saline to thin the mucus and cough it out. Antibiotics are used to treat the infections associated with cystic fibrosis. Many patients require lung transplantation, but lung transplantation is risky because of possible chronic bacterial infections. I never mentioned another condition which we hear about quite often now. It's pneumonia. Pneumonia can be bacterial or viral. It leads to basically the accumulation of fluid in the lungs, and that reduces the gas exchange across the respiratory membrane. And finally, what about age and respiratory system? Well, lungs inflate at the birth. Fetuses do not use lungs. And it takes some time before lungs work to their full capacity. Lungs actually become more and more functional until young adulthood. With age, lungs become less efficient, lungs become stiff due to the pulmonary fibrosis or sarcoidosis. Decreased elasticity of the thoracic cage leads to decreased ability of lungs to inflate. Scoliosis and other skeletal abnormalities may affect the ability of a person to inflate the lungs.